Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is March 5th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 116 million cases and nearly 2.6 million deaths. In the United States, we have over 29.5 million cases and nearly 535,000 deaths. This week in COVID-19 news, the CDC Director, Rochelle Walensky, warned states that it's not yet time to remove mask mandates. Some states, including Texas and Mississippi, have decided to repeal their mask mandates, even though the current pandemic situation really doesn't call for repealing any mask mandates. In fact, the opposite is true. Some other states never even implemented any mask mandate to begin with, and they really should have. We should be basically having a mask mandate right now throughout the entire United States. Many other countries should also have them because the science is clear. It works. Masks work. Just because we've been seeing a drop in cases, hospitalizations, and deaths does not mean that we should throw all the precautions out the window. The reason why we're seeing the drop is because of those precautions. If we just stop using those precautions, we're going to go back to the way it was. We need to have something else in place, and that's what the vaccines are doing. The vaccines are helping us build up our herd immunity so that we can eventually get rid of all these extra precautions like masks and social distancing and all that. But if we get rid of them too soon, the vaccines won't be in place, herd immunity won't be working, we're just going to go right back. We're going to mess it up so that the vaccines won't have a chance to work. So, that being said, there are some places that are a little too strict. Some places in California come to mind. Other cities, typically it's not entire states for the most part, but it's mostly local, like cities and towns that are being a bit too strict. Some things, for example, that we don't want to see is governments making rules that say you can't even go outside without a mask, even if you're completely isolated from everyone else. Things like that, or saying you have to wear a mask even if you're around your own family members. Those are things that, yes, they might help possibly, but they wouldn't help very much. And the evidence suggests that in many cases they wouldn't help at all. So we don't want to have all these extra things that are burdensome to people. They start rebelling against stuff, and they don't even want to do the stuff that does work. So in public health, we see this a lot. We basically have to weigh the consequences of the decisions we're making. We have to take into consideration the science, both the benefits of what we're trying to get done and the negative side effects of it. We also have to weigh the feelings and beliefs of those that we're trying to help. Depending on all those different things, we try to make the decision that ends up being, the most effective with the least number of bad consequences, the negative side effects. So, for example, right now we're not in lockdown really. Some municipalities might have limited lockdowns type stuff, but generally speaking, the United States is not in lockdown at all. We are encouraging masks because those actually work. Lockdowns would work, but there's a lot of negative side effects. And so, we started out with that because we thought it was a lot worse than that it was. Ended up, people rebelled against it. So a bunch of governments got rid of them completely. It ended up being worse than we thought it was at that point because our opinions had changed. We thought, it was terrible at first, and it became, it's not that bad. And then, it's actually worse. It's been going back and forth depending on what we find in public opinion and the actual science when we actually do the studies. And so now we're in a good place where we pretty much know the science behind it. There's a few minor things that we don't yet know, but the big picture we know. We know things that work. For example, we've got the basics that we want to have out. There's some extra stuff we could do to maybe help the pandemic end even sooner, but there's more pushback on those things, and so we're trying to do just the basics, which are wearing a mask, especially if you're out and about around people, or even in any building that it's not your own home, even if you are socially distanced. Avoiding the large crowds, doing the social distancing, washing your hands, and of course, getting the vaccine when it's available to you. Those things are the basics. We want to have those things in place. Even though there is, pushback on that in some groups, some groups of people still find controversy in those things. But those are the bare minimums. Those are the things we need to see happen. Those are the things that are the least controversial. Even though masks tend to seem to be very controversial, in reality, on the scientific side, there really is no controversy. It's clear. The science is clear. Masks work. And it's a very simple thing to do. No real big side effects or anything like that for pretty much anyone. So it's one of those simple things that we just recommend people do. So concerning COVID-19 numbers, last week and for the first part of this week, it seemed like we'd hit a plateau because we'd been decreasing for a while since the holidays, and then we hit a plateau. Well, thankfully, towards the end part of this week, we've actually started to go down again. Now, it's just a few days. It might be a fluke, just like the plateau might have been a fluke. We don't know yet. We'll see. It looks hopeful, though, that it's going to continue going down. We really hope it will. And we really hope that taking these mask mandates off the table is not going to cause a major issue. Hopefully people, even without the mandates, will still decide to wear the masks. Unfortunately, there's a lot of people that tend to look at the government and say, hey, you're not forcing me to do this anymore. That means I'm not going to do it, which is not good. I wish that everybody would just do the right thing, regardless of whether you're forced to or not, or regardless of whether there are legal consequences or not. But unfortunately, that's not the case. Lots of people try to do as much as they can, getting away with anything they want to, as long as there's no legal consequences. And so we've got to face that. And that's why it's important to keep those mask mandates in place, because it helps to rein in that kind of crowd that tends to do that. So vaccinations have been reaching about 2 million people a day over the last couple of weeks. And so that is not quite where we want to be, but it's a big improvement over the last few months. Where we really want to be is about 3 million people getting the vaccine every day. If we can do that within the next month or so, and then keep that level up, then we'll probably hit herd immunity around mid to late summer. That's a big thing. I mean, if we can do that, that would be amazing. There's always variants to watch out for because they may cause that to be extended a little bit into fall, but hopefully not. Things are looking up right now. Dr. Fauci stressed this week that the most important numbers for vaccinations are not the effectiveness percentages for just getting sick, because we don't care that much about mild sickness or asymptomatic cases. People get over that, no problem. We're not worried. What we really care about and what numbers we're really looking at is the effectiveness for each vaccine at keeping people from dying or being hospitalized with severe symptoms. And right now, all 3 vaccines that have been approved in the United States do an excellent job at that. They're all virtually 100% effective at that. So that's amazing. And Dr. Fauci pointed out, if you're offered any type of vaccine, doesn't matter which brand it is, take it, because you don't want to wait and see if maybe there's one that's a higher effectiveness rate for the mild stuff, because who cares? Nobody cares about a mild symptoms. You'll get over it just like you do a cold. It's no big deal. What we really want is for people not to die from this. And so if we do that, whether it's the Johnson & Johnson, Pfizer, Moderna, or fairly soon, hopefully, the AstraZeneca, it really doesn't matter. We're all going to be able to be vaccinated. We're going to build up that herd immunity. We're not going to die from this. And that's the important part. Also, many doctors are reporting that patients who get the COVID vaccine that used to be long-haul COVID survivors, they still have those symptoms months after getting COVID and supposedly recovering. They're seeing that once they get the vaccine, those long-haul symptoms are going away. These are all anecdotal. There's no study that's been done yet on this, but that's awesome. If that ends up being true and we're able to verify that through studies, that's a big step, because we've been wondering if vaccines would do that or not. And as of right now, it looks like they probably do. It looks like they are helping with that, so that's great. Let's move off of COVID-19 and on to nutrition news. First off, there's a recall for Hispanic soft cheeses. Please check the link below the video to get more information on that. We don't want you to get sick or anything, so please check that. A new study shows that artificial sweeteners may increase the chance of bacteria becoming resistant to antibiotics. Artificial sweeteners typically have no or very few calories, and so they're very popular among those who are trying to lose weight or are trying to be healthy in general. But this is just one more entry in the long list of issues that we've seen with artificial sweeteners. They're not typically the best option. Generally speaking, they seem to be okay for most people, but there are all these little things that kind of add up. So if you can avoid artificial sweeteners, it's probably best to do so. The scientific evidence isn't yet very strong, but it is there. And so being cautious is warranted. Also, a new study found that fructose can cause inflammation and cause the effectiveness of our immune system to be reduced. So fructose is a sugar that's found in all sorts of food, but especially in fruit. It's very prevalent in fruit. And we're not really worried about the fruit, actually, because the fruit, in order to get so much fructose that it would actually affect your immune system, you would have to eat so much fruit that you would just be bursting at the seams. Plus, the fruit comes with the extra antioxidants and fiber, all of which help block that inflammation and turn back the issues that you would see with the immune system. So if you're eating fruit, don't worry about it. You're not going to have issues with this. Fruit juice, it's a little bit higher risk. You still get the antioxidants, though. You don't get the fiber. But still, chances are you're not going to drink enough fruit juice to cause this issue either. The big problem that we're seeing is with the high fructose corn syrup, because that is a concentrated fructose that is just stuck into everything. It's part of pretty much every processed food out there, and a lot of foods that you wouldn't even think are processed have it in them. Even things that you wouldn't think need sweetening, some of the salty foods or other things like that have high fructose corn syrup. And because it's so concentrated and it's so available, that has a high chance of getting you to the level where it'll affect your immune system. This is another one of those things, just like the artificial sweeteners, where there's not a whole lot of strong evidence that shows that it's bad for you, but there is evidence starting to build up. It's starting to build up enough that scientists are starting to say, hey, let's take a step back here and maybe consider not using this as much. So again, every now and then, if you have some high fructose corn syrup, probably not a big deal. But if you're constantly eating it, in the ingredients of whatever else you're eating, it could end up being an issue. So just something to watch out for. Yet another study released this week has found that diets high in plant-based foods and low in saturated fat and animal-based foods is actually good for the heart and brain. This is not really news. It's just another study to add to the multitude of studies that have shown the same thing. At this point, the science is very clear on this. Plant-based diets are good. Animal products are still fine. They've got good, good vitamins, minerals, and things like that in them. Good quality source of protein. Just don't rely on them as the main part of your diet. If we may not know the exact details of, say, a good or perfect ratio of plant-based to animal-based, and most likely it varies per person, and so we probably won't ever know the perfect ratio, but we do know that more plants is better. And so, make your own personal choices, but just keep in mind that you should be eating more plants than animals, and quite a few more plants than animals is what the studies are saying. So let's just try and be a little healthier. So thank you for watching the Plain English Public Health Weekly Report for March 5th, 2021. I'm Richard Greenland, and you have a wonderful, healthy weekend.